But it's a good painful.
This is very painful, right?
I lost all dorsiflexion in my ankle last year. All of it. It took a while for me to get any back.
This is more painful.
That doesn't hurt at all.
This does not hurt at all.
Nope.
But this is painful.
Yes, I feel it pulling right where I pointed to before.
This is painful.
Nope.
How about this?
No, but it feels great. So about a year ago I fell and I landed on my foot wrong and it was really painful. I couldn't move my ankle around, couldn't move my toes around. Then it got better, but then recently the pain started back up and it just feels like it constantly needs something and it just needs to pop. But nothing would release. So I have hobbit feet.
Well, somehow it gets stuck since 1 year. So because you have little bone, and actually the foot itself is a engineering miracle. So if you ask somebody who never seen a human being and to build with engineering principle, nobody's going to build up with like that. We usually mix a tall building with a bigger base of support. But the amount of height what we have, in compared to that, the foot is very small.
Yeah.
The design is very weird. So any little thing in your foot is going to show up 4, 5, 6, 7 times. Sometimes we take these things very lightly, and especially it'll be some other day or some other time. Most of the women, especially girls, even younger girls, they will have more ankle injury as well as toe injury because of the biomechanical issues. Yeah, I can hear it. Do you hear it?
Ooh, oh yeah.
Because it got loosened up now. Do you hear that?
Yeah, I feel that. It feels
Do you hear
wonderful.
that? You see that? Now it loosened up. So once we kind of establish the normal motion, most of the time pain is mechanical. So once we establish the mechanical motion, obviously her pain is going to go away. She should be able to not only feel it, hear it. That is moving how well. Is it painful now?
Very little compared to what it was.
Okay.
I'm also going to tell Jennifer.
And usually, without non-traumatic for pain, if somebody get into foot surgery, things get out of control because they get more even jammed up, and that cascade into a huge issue. So somebody has a broken bone or something like that in the foot, having surgery, that's okay. Without that is a huge issue. Oh yeah, everything is popping.
Yay.
I can feel it all the way up to my knee almost.
Yep. Go to remove the other shoe and walk around.
Okay.
It'll be hard for you to walk.
I said, we just need you to verify that that's your primary.
It feels much better. I don't feel it at all actually. No more weird feeling. Oh, still
And
popping.
actually, all his problem is not over. You can see her feet is more putting weight on the inner side than outer side. Right?
Yeah. My shoes wear down in the
Yeah, inner side. So that's why she has more injury over here. So that's what we call as a pronated foot. But that's okay.
So, what is your recommendation as far as like orthotics? Should she
No,
wear
no, no,
them?
no, no orthotics. You should never ever use any orthotics because your body can take care of it on its own. So foot orthotics are just useless because once you change, your whole body is connected. Everything else is going to change. So in fact, we tell people not to use any orthotics, remove it, just to promote natural motion. Once you give orthotics, the foot loses its own natural motion. So that's not a good thing. That's actually a terrible thing to do. So she's fine the way it is. So some time things does not move, you move it a little bit, then your pain goes away completely. The normal uses is the best. You don't want to restrict your food, or I just against any kind of bracing or orthotics or anything per se, because that reduces the natural motion.
Okay, great.
Thank you.